Welcome to this week's edition of Endocrinology Updates, covering the latest breakthroughs, brought to you by LucidQuest, a major milestone in regenerative medicine. Vertex's investigational stem cell therapy, Zimislecel, has shown transformative potential for people with type 1 diabetes. In a recent trial, all 12 participants reached American Diabetes Association glucose targets. Remarkably, 10 of them are insulin-free after 1 year. The therapy delivers durable endogenous insulin production with no severe hypoglycemic events. These results, published in the New England Journal of Medicine and presented at the 2025 ADA meeting, mark a potential paradigm shift in diabetes treatment. Meanwhile, Endocrinology has introduced a novel duodenal recellularization therapy for type 2 diabetes. This procedure uses pulsed electric fields in the duodenum to restore gut health, targeting a new pathological concept called diabetic duodenopathy. Early results from the Regent 1 study will be presented at ADA. In China's Hainan province, the FDA-approved drug Tzield is now available as part of the Bo Leisheng Pilot Zone initiative. Tzield has been shown to delay the onset of type 1 diabetes by nearly 3 years. The rollout reflects Sanofi's broader strategy to expand diabetes treatment access in Asia. Amgen has reported promising Phase 2 data for MariTide, a weight loss peptide that delivers sustained results in patients with type 2 diabetes. Unlike daily injections, MariTide is administered monthly, or even less frequently. The upcoming Phase 3 MariTide trials will further evaluate its clinical benefits. In predictive care, artificial intelligence models are now able to identify the risk of developing type 1 diabetes up to 12 months before symptom onset. By analyzing medical claims data, the models show high sensitivity in both pediatric and adult populations. The approach reduces false positives and supports earlier interventions. Abbott's Food is Medicine program is improving health outcomes for diabetes patients through prescription nutrition. In a randomized trial in Stockton, California, participants significantly improved fruit and vegetable intake and perceived health. The program achieved a 98% satisfaction rate and resulted in a clinically meaningful A1C reduction of more than 0.7%. Biodexa has launched a Phase 2A trial of an oral therapy for type 1 diabetes. The investigational compound, tolimidone, enhances insulin signaling via Lin kinase activation. The first patient has been enrolled at the University of Alberta. This therapy may offer a pathway to reduce or eliminate the need for insulin injections. In renal health, the gold standard trial is testing a 4-drug combination to treat diabetic kidney disease. The regimen includes an SGLT2 inhibitor, a GLP-1 receptor agonist, a mineralocorticoid receptor antagonist, and a renin-angiotensin system inhibitor. The trial incorporates patient input to improve the design and deployment of this proactive treatment approach. In thyroid care, a large language model-based AI tool has demonstrated over 90% accuracy in diagnosing thyroid cancer. The system classifies cancer stage and risk while reducing clinician preparation time by around 50%. It operates fully offline, helping ensure patient data privacy. In osteoporosis, Metamaps has expanded into the United States with its AI-driven TBS Osteo Advanced software. Now FDA cleared and reimbursed by Medicare, this tool analyzes lumbar spine images to evaluate bone microarchitecture. It is already in use at 16 of the top 20 hospitals in the country. Finally, the Royal Osteoporosis Society has launched a free digital guide for patients. The Bone Med service delivers personalized medication information and reminders via email. The initiative aims to improve adherence and education for over 3 million osteoporosis patients in the UK. Stay ahead in endocrinology research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.